The year was 1998. A chill settled over Somerset Medical Center in New Jersey. A nurse, Charles Cullen, had just been apprehended. He was suspected of unspeakable acts. Cullen, a man entrusted with patients' lives, was accused of taking them instead. The news sent shockwaves through the community. How could this happen? A wave of fear and uncertainty washed over everyone. Cullen's crimes were a stark betrayal of trust. He was supposed to heal, not harm. As investigators dug deeper, a horrifying truth began to unfurl. Cullen's reign of terror had spanned years, multiple hospitals, each haunted by unexplained deaths. The scope of his crimes seemed unimaginable. Cullen's case became a chilling reminder. Evil can lurk behind the most ordinary facade. Cullen used his knowledge of medicine for sinister purposes. Lethal injections. Cullen's method was simple yet effective. He would sneak into patients' rooms, a phantom in the night. With the syringe in hand, he would inject fatal doses of medication. His victims, often elderly or critically ill, stood little chance. They were already fighting for their lives, unaware of the new threat. Cullen fed drugs like digoxin and insulin. These medications could be deadly in the wrong doses. They were also difficult to detect in toxicology reports. Cullen's actions were calculated and cold-blooded. He showed no remorse, no hesitation. Each injection was a life extinguished, a family left to grieve. Rumors began to circulate within the hospitals where Cullen worked. Section 6 justice delayed. For years, Charles Cullen operated with impunity. His crimes went unpunished, his victims forgotten. But in 2003, his luck finally ran out. He was working at Somerset Medical Center in New Jersey. A suspicious death triggered an investigation. This time, authorities were determined to uncover the truth. They meticulously reviewed patient records, interviewed staff, and exhumed bodies. The evidence against Cullen was overwhelming. He was arrested and charged with multiple counts of murder. Finally, the reign of terror was over. Section 7. Unmasking evil. Charles Cullen's arrest sent shockwaves through the nation. People struggled to comprehend how a nurse, sworn to protect life, could commit such heinous acts. Cullen's motives remained murky. He claimed he was ending suffering. However, many of his victims were not terminally ill. Some speculate he enjoyed the power over life and death. Others believe he was driven by a twisted sense of mercy. Whatever his reasons, Cullen's actions were those of a cold-blooded killer. He had preyed on the vulnerable, exploiting their trust and his position of power. His crimes were a stark reminder of the darkness that can reside within the human heart. Section 8. A legacy of loss. The true extent of Charles Cullen's crimes may never be known. He confessed to killing 40 patients, but investigators believe the actual number could be much higher, perhaps as many as 400. Many records from the hospitals where he worked have been lost or destroyed. Some deaths, initially attributed to natural causes, are now viewed with suspicion. The families of Cullen's victims are left with unanswered questions. They grapple with the pain of loss, compounded by the knowledge that their loved ones' deaths were preventable. Section 9. The unanswered questions. Charles Cullen's case remains a chilling reminder of the importance of vigilance and accountability. It highlights the need for better safeguards within the healthcare system. His crimes exposed a culture of silence and complicity. In the wake of the scandal, hospitals implemented stricter protocols for medication dispensing and reporting suspicious behavior. The case also led to legislation aimed at improving communication between healthcare facilities and strengthening background checks for healthcare workers. The legacy of Charles Cullen is a dark one, a stain on the nursing profession, but it is also a call to action, a reminder that we must always remain vigilant in protecting the vulnerable.